Most people don't realize it, but the human body often gives subtle warnings when it is nearing the final stages of life. These signs may not always be obvious, and they can be easily overlooked or mistaken for normal aging. However, recognizing them early can help families provide better care and ensure their loved ones are as comfortable as possible in their remaining time. Aging is a natural part of life, and for many elderly individuals, their final year may come with changes that signal the body is slowing down. While every person's journey is unique, there are certain warning signs that may indicate the end is near. These signs are not just about physical decline, they also include changes in energy levels, mental state, and the body's ability to recover from illness. In today's video, we're going to discuss 5 crucial signs that an elderly person may be in their final year. These are not meant to create fear, but rather to offer guidance, support, and understanding, so you can recognize the subtle signals and make informed decisions about your loved one's well-being. If you notice any of these signs, it may be time to have important conversations with medical professionals and family members to ensure the best care possible. Let's begin. Number 1. Significant weight loss. One of the most noticeable and concerning signs that an elderly person may be nearing the end of their life is unexplained or significant weight loss. While some weight loss is a natural part of aging, extreme weight loss can be a signal of a serious underlying issue. It can be a result of several factors, including a decrease in appetite, difficulty chewing or swallowing, or underlying medical conditions like cancer, heart disease, or kidney failure. If you notice that your loved one is losing weight at a faster rate than expected, it's important to consult a healthcare professional. The elderly body tends to burn calories faster and may have less muscle mass, but a drastic decrease in weight without any changes to diet or physical activity may indicate that the body is in a state of decline. This could also lead to complications like weakened immunity, frailty, and muscle loss, making it harder for the person to recover from illnesses. Number 2. Decreased mobility or inability to move. Another sign that an elderly person may be entering their final stages of life is a noticeable decline in their ability to move or participate in physical activity. As we age, our joints and muscles naturally lose some of their strength and flexibility. However, when there's a sudden or rapid decline in mobility, such as an inability to get out of bed, difficulty walking, or the need for constant assistance, it could be an indicator that the body is no longer able to keep up with basic functions. This may happen due to a weakening of vital systems in the body. For instance, the heart and lungs might not be able to supply enough oxygen to the muscles and tissues, leading to fatigue and weakness. If there are also signs of increased shortness of breath or difficulty breathing, this could be a serious concern and may indicate that the body's organs are starting to shut down. Number 3. Constant fatigue and extreme sleepiness. While it is normal for some elderly individuals to experience more sleep as they age, an increase in fatigue and excessive daytime sleepiness can be alarming. If an elderly person is sleeping for prolonged periods or even entire days, it may indicate that their body is beginning to lose its ability to function at its usual capacity. The body's systems become less efficient as a person ages, which can lead to chronic fatigue or an overwhelming need to rest. Excessive tiredness could signal issues with vital organs such as the heart, liver, or kidneys, all of which are crucial for maintaining energy levels. When these organs begin to deteriorate, the body often struggles to provide the energy needed for daily functioning. Additionally, persistent sleepiness might be a sign of the body gradually preparing for the final stages of life, especially if it is accompanied by other signs of deterioration. If an elderly person begins to spend most of their time sleeping and shows difficulty staying awake even during activities they once enjoyed, it is important to monitor the situation closely. Sometimes lethargy may result from underlying pain, illness, or discomfort that the individual may not be able to express, especially if cognitive decline is present. This lack of communication can make it harder to identify what may be causing the fatigue. A sudden or significant shift in sleep patterns should always be addressed with a healthcare professional. Excessive sleepiness, while it could be a symptom of natural aging, may also indicate a serious medical condition that requires immediate attention, such as infection or organ failure. Number 4. Difficulty recognizing loved ones or severe confusion. Cognitive decline is one of the most well-known effects of aging, but when it begins to interfere with a person's ability to recognize family members or causes severe confusion, it may indicate that the person is nearing the end of their life. While memory loss or disorientation can result from conditions like Alzheimer's disease or dementia, sudden or rapid changes in cognition can also be a sign of advanced decline in health. If an elderly person begins to forget the names of loved ones or is confused about where they are or who they are with, it suggests that their brain function is deteriorating. As the body nears the end of its life, cognitive processes become more difficult to maintain. This loss of recognition is not just about memory. It signals that the brain is no longer functioning at its optimal level and that the person is losing touch with reality in a more profound way. Additionally, people experiencing these cognitive changes may become increasingly withdrawn. They might lose interest in activities that once brought them joy or avoid social interaction entirely. This withdrawal is often a sign that the mind is disconnecting, and the person may no longer have the mental energy to engage with the world around them. While these changes can be heartbreaking for families to witness, it is important to understand that they may be part of the natural progression toward the end of life. If confusion or memory loss becomes severe, it is essential to consult with healthcare providers to manage the person's care and comfort during this challenging time. Number 5. Unexplained infections and frequent hospitalizations. As people age, their immune systems become less efficient, making it harder for the body to fight off infections. This weakening immune response can lead to frequent, unexplained infections, which can be a serious sign of advanced health decline. Common infections, such as urinary tract infections, UTIs, pneumonia, and skin infections, may not only occur more often, but may also be more difficult to treat in elderly individuals. If infections seem to linger longer than expected, reoccur regularly, or do not respond to treatment, it could be a signal that the body's systems are no longer functioning optimally. As the organs gradually lose their ability to perform at full capacity, the immune system becomes less able to fight off bacteria and viruses. This can lead to prolonged illness and increased vulnerability to new infections, which can take a significant toll on the body. Frequent hospitalizations due to infection or other health issues can be another warning sign. If the elderly person is regularly admitted to the hospital or requires frequent medical attention, this could indicate that their body is no longer able to recover effectively on its own. It's also possible that underlying conditions such as organ failure, sepsis, or other severe health problems are contributing to their declining health. If infections persist or become more frequent, it is crucial to consult with a doctor to determine the cause. In some cases, it may be a reflection of the body's gradual decline and the beginning of its preparations for the final stages of life. Proper medical intervention can help manage infections, but it's also essential to recognize that in some cases, the body's inability to recover may be a sign of a deeper, irreversible issue. Aging is an inevitable part of life, and while we may not always be able to predict exactly when someone's time will come, the body often gives us subtle warnings. Recognizing these signs, such as rapid weight loss, loss of appetite, excessive fatigue, cognitive decline, and frequent infections, can help us provide the best care, comfort, and support to our elderly loved ones. These changes are not just medical, they are the body's way of preparing for the final transition. If you start noticing these signs, it's essential to have open and honest conversations with healthcare professionals and family members. Prioritizing comfort, dignity, and quality of life during this stage can make a significant difference. Whether it's arranging proper medical care, spending meaningful time together, or simply ensuring they are at peace, your support can mean everything to them in their final days. Thank you for watching today's video. If you found this information helpful, please consider liking and subscribing to our channel, Elderly Advice, where we share essential insights on aging, senior health, and well-being. If you have any experiences or thoughts to share, feel free to leave a comment below. We would love to hear from you. Take care, cherish your loved ones, and remember that every moment spent with them is a gift. Until next time, stay well and stay informed.